Okay, we're going to be talking about chapter 20, which is large animal nursing. There's a lot of information in this chapter, and I'm going to break it down into different groups of species. So we're going to do equine, then we'll do bovine, then we'll do small ruminants, which are ovine and caprine, and then we'll talk about swine and camelids, the groups of camelids. So we'll go through each of these, we'll take a break, and you can switch to a different uh, lecture when you're ready for it. One thing I do want to bring to your attention is that in your eLearn, and I'll show you here, there are some Word documents and they are labeled as such. What these Word documents are a way of breaking this down into uh, more understandable information in chart form. Obviously, it's not going to include everything about every disease, and basically, it's just going to cover, what the disease is, what the cause of the disease may be, the symptoms you'll see, and then the treatment and control or prevention that we can do with each disease. What I'd like you to do is, I really think it's important for you to have these on hand as you're studying for things, and this will mean from this class to our large animal medicine class, to your clinicals, to studying for the VTNE. So this is going to be around for a long time, even if you decide you're not going to go into working with large animals at all. And you may even want to keep it for later, because at some point someone may ask you a question about a large animal and expect you to have some sort of answer for them. So at least you can have the basics right in front of you. So I do recommend that you print these out, put them in a binder, and definitely have them in front of you while you're going through the lecture in order to refer to this in writing as I'm talking about things. Um, when we're talking about large animals, it is important that you understand that just like there are different breeds of dogs and cats, there are lots of different breeds of horses, cows, etc. So having a basic understanding of what you're looking at, it's not just a horse, but there are different types of horses, and you can see the different types based on their outward appearance. So I just have some really easy ones for you to take a look at, some pretty common ones that we will see in the fields around Ohio. Um, this is a Morgan horse. The Morgan horse has a smaller head. They're kind of it's a breed in and of its own, but they do descend from saddlebreds and Arabians, so they kind of have some features of both. They are kind of thinner, more defined horses with a smaller head. When you see pictures of them, especially show pictures, they're going to be parked out. This is what is called parked out. And this is where they're upright on their front and they are stretching their rear legs back. This actually makes it a little bit more stable and easier for you to mount them, and that's the reason that they show them in this way. This is an Appaloosa, and Appaloosa has very distinct pattern, typically on its rear end, a very spotted pattern. In this back area, Appaloosas were bred from Spanish horses that were brought over by conquistadors, and they were bred as in Indian or Native American lands for this, not necessarily for specific patterns, but they tend to be really good endurance horses. This is a quarter horse. A quarter horse is known for racing a quarter mile, so that is a sprint versus a distance that a thoroughbred would do. And so with sprinters, they tend to have much more muscular rear ends, and a quarter horse will have a very large rear end. They tend to have really tiny little feet too, which can lead to problems in the breed. They have a pretty not long head, but kind of a chunkier head. But what you're really looking for is that haunch, that big haunch in the back. This little guy shown up against some long grass is a miniature horse. A miniature horse should be perfectly proportioned and look just like a larger horse. They don't always look like this. A lot of them are, as they were bred, some more of the dwarfism traits. So you see the bent legs and the odd mouth. Some genetic abnormalities came from trying to breed horses down to a miniature level, but they should look like a miniature horse. These are not ponies. Ponies are equine that are smaller than 14 hands. These guys are actually considered miniature horses, not ponies. Um, Over here, this is a Belgian horse. It's a draft horse, a great big stocky type horse with feathers. We call these feathers on their limbs, just long hair. These can come in a variety of colors, but they tend to have a really thick neck, just a really heavy appearance. This is another draft horse called a Clydesdale. You might think of this as a Budweiser horse. They have white socks or white stockings that can go all the way up, and typically a white blaze on their face. They tend to be tall. Well, actually, these both are pretty tall horses. The Belgian tends to be just thicker in general. This is a thoroughbred. A thoroughbred is a horse that's bred for racing primarily, but is also used for eventing or jumping. It is a sport horse. It's kind of a hot-blooded horse or a warm-blooded horse. These are called warm bloods. They tend to be pretty gentle horses. Hot-blooded horses tend to be a little bit more excitable, just for a difference there. They have very even proportion. They have a longer nose. They have their rear haunches and their front haunches are pretty well muscled. So this is a typical thoroughbred horse. This is a Frisian. A Frisian horse is a pretty flashy horse. They're used for drawing carriages or riding. They tend to have feathers as well, so they have furry feet, and tend to be all black. These guys have a nice smooth gait, don't trot so much as walk in a fast manner. This is an Arabian horse. The way to see an Arabian horse, they tend to have really fine features throughout, especially their head, and they tend to have a dished forehead. A dished forehead it means that they have kind of a concave forehead here. It comes down and it goes a little bit concave. This is one of the oldest breeds of horses, bred in Arabia, basically. They tend to be pretty hot-blooded, so highly spirited. They tend to flag their tail up quite a bit, which just means that they're excited about stuff. So Arabian horses are pretty common. They come in lots of different colors as well. I have here a Rocky Mountain horse. The Rocky Mountain horse has a very specific, usually a very specific coloring. That's why I have this on here, because they can be pretty easily picked out with a chocolate coloring and a flaxen mane and tail. I do have a Rocky Mountain horse, but she does not look like this. She has, partly because she's probably not entirely Rocky Mountain, but she is a reddish color with more of a red mane and tail. These guys are a little bit different, just like the Frisian. They tend to be gaited horses. Gaited horses like the Tennessee Walker and the Rocky Mountain, and there are a couple of others that we can see as well. They instead of trotting where you're thinking about bouncing up and down as you trot, they have a gait that is much like if you're thinking of somebody who does speed walking. If you picture somebody speed walking, they are moving their legs really quickly, but they're not, their top half is very, very smooth. And so riding these guys is a lot smoother than riding a typical horse. They don't trot, they gait, and it's a little bit faster than a trot as well. Okay, so we're going to go right into diseases with these horses. I'm going to start with respiratory tract because it's the tip of the nose. So the horses with strangles have basically a strep infection. So if you think about strep infection in kids or in people, they get swollen lymph nodes, and it's pretty painful. The lymph nodes can get so swollen that they actually abscess. and you'll get a draining lesion from these lymph nodes. It is a highly infectious disease, and if we have strangles in the barn, we have to quarantine that entire barn, isolate the horses with strangles, and hope that it doesn't pass to the rest of the barn. They have a lot of loss of appetite, purulent nasal discharge, a lot of fever can happen in young horses. It can be devastating to a barn. We can lose a lot of horses this way, and just because it's infectious, some horses that are diagnosed with strangles will actually be euthanized and not treated. Guttural pouch empyema. You have to understand that there's a certain anatomic feature of the horse that we don't typically see in other animals. There is an opening to this odd little pouch in their head or on the side of their head called the guttural pouch. Now, evolutionarily, we think this developed to provide an extra source of air as they are running. So it connects from the eardrum to the eustachian tube to the pharynx or opening into the mouth, and it contains just air, or should contain air. If these one-way valves, or these valves are not one-way, if they're not functioning normally, we can get an accumulation of air into this guttural pouch. We see this empyema in foals a lot, where they're just not well developed enough and it kind of seals off the air. Typically they'll grow out of this. Unfortunately, as things go in there, it's possible for them to get infections that don't clear out very well. So one of the things we see is a mycosis or fungal infection, and the causative agent is often an aspergillus fungus, so that's important to remember. They cause these plaques of fungi to grow inside this pouch, and those fungal plaques eat away at the tissue. And unfortunately, because of where this is located anatomically, it is right by the carotid artery. So it will eat away at the lining of the guttural pouch, through the lining of the guttural pouch, and right into the carotid artery, which will, if you break open the carotid artery, the animal will bleed to death in about 8 seconds. So sometimes what you'll see is some nasal discharge, some nasal discharge, some nasal discharge, and then the animal will die. So very, very quickly. So when we see nasal discharge, we do get concerned pretty quickly and try to find the cause of that. Horses do get the flu. There's a vaccine for the flu. It is one of the core vaccines that we typically want to give, especially to horses that travel or are in contact with other horses, because it is a contagious disease. With the flu, it's a respiratory disease. So we are seeing a feverish animal, just doesn't feel well, head hanging low, lots of stuff dripping from their nose. They just feel like crap. This is showing somebody suctioning out the nose, trying to clear the discharge. Herpes. Herpes is a retrovirus that stays in the system for a long period of time, is passed by nose-to-nose contact. They do have it can cause abortions as well, so there's it's a disease that can be passed along, and if it's passed to a pregnant mare, then she may abort the fetus. So respiratory disease causes abortion, passed by nose-to-nose contact. We do have a vaccine against it. So this is showing a veterinarian vaccinating a horse. I will point out that he has the cap of the needle in his mouth, which that is a big no-no, because we don't want to uncap or recap the needle with your mouth. Something that goes along with this a little bit is viral arteritis. This is a sexually transmitted disease, and it is carried by the stallion. It was a natural reservoir of viral arteritis. That means that they carry it normally and can be somewhat asymptomatic. But when they pass it on to a mare who becomes then that mare will have some loss of fetuses, congenital disease, will pass it along to their offspring, have abortion, and so that can cause some problems. So if we do have a carrier stallion that has equine viral or arterial virus or viral arteritis, we do want to cull that stallion, not use them for breeding at all. Occasionally, you'll see some swelling of the testicles or in the scrotum, but there's not a lot of signs. That's why they can pass it along before you see signs. Okay, so that's the respiratory disease. I guess this does cause some respiratory disease as well, but I did want to put this in there next to the herpes so you can remember it's a sexually transmitted disease. Equine cardio. So when we're talking about the cardiovascular system, there are a couple of diseases that can cause common diseases that we can see problems with. First one we're going to talk about is equine infectious anemia. Equine infectious anemia is passed by a biting fly. There are different degrees of infectiousness. And this is really with just about all infectious diseases. We have acute, we have chronic, and we have an inapparent carrier. An animal that is affected acutely and is very, very sick and is very anemic, it takes about 1/5 of a teaspoon, which is 1 millimeter, of the horse's blood to contain enough virus to infect 1 million horses. So an animal that is actively ill from this anemia, if a biting fly jumps on it, it will pass it along to another horse within a 5-mile radius, because that's about how far we can expect, or actually a 200-yard radius. So if you have an animal that's infected on your property, chances are everybody else on that property is going to get infected as well. We can have a chronic case. That means they carry the disease, but it's a little bit more dispersed and smaller um, uh, amounts in its bloodstream. If they're having a feverish episode, then they will have enough virus to infect 10,000 horses. If you have an inapparent carrier, that means they're carrying the disease, but you're not seeing the symptoms of the disease. One horsefly out of 6 million is likely to pick up and transmit the EIA virus from the horse. So it's not as common, but they can still be infectious. Anytime we see chronic cases, often we'll see muscle wasting. That's why I have this picture here. Because this disease is so infectious, it is something that we keep an eye on. And the way we keep an eye on it is to do a blood test. And we do recommend this blood test be performed yearly in horses, especially horses that travel anywhere in or out of a state, or go to a horse show or someplace where there are a lot of horses gathering. In fact, it is required of most venues where they accept your horses that you do have a current Coggins test. The Coggins, Coggin apostrophe S, is named after somebody who came up with the test, to test for the antibodies for this anemia. Now, most of the time, these Coggins tests will come back negative, but we still need to test every year because we have new horses in the environment. We have flies moving from horse to horse, etc. So it's important to test. It's kind of like doing a heartworm test on a dog or a cat. We do want to test for equine infectious anemia yearly. So this is something you will commonly see. If an animal is found to be positive for equine infectious anemia, this is a reportable disease, which means that we have to report it to the USDA. They will then come in and investigate the farm and the situation and the horse, and recommend either euthanasia or quarantining the horse. The horse would have to be quarantined at least 200 yards away from any other horse, and they would have to be quarantined for life. So this can be really difficult for horses because they are herd animals. They can get used to it, but it is really difficult. So a lot of people do choose to euthanize. So it's a very serious disease. All right. There are other cardiovascular diseases. Horses do get infections of the heart valves and heart failure, etc. But that is the most common one that we see that we need to talk about. Gastrointestinal disease, anything that causes abdominal pain is called a colic. So it can be any one of these things that causes a colic. Gastric ulceration in the stomach due to eating too much grain or too green of grass, or taking a certain medication that causes ulcers. That can cause severe pain for horses. Remember, they're eating grass and hay, and so that's pretty sharp stuff going into the stomach. And those things rubbing against ulcers can be pretty damaging and pretty painful. Colonic ulceration is when we have ulcers in the colon, can cause some bloody fecal material to come out and can also be very, very painful. What causes colonic ulceration? I have this medication here. It's called phenylbutazone. It's an anti-inflammatory medication that we use frequently with horses that have owies, painful lameness, that kind of thing. If it's used for too long, too much for too long, it's the most common cause of colonic ulceration. So we use caution when using phenylbutazone, which we also refer to as bute. Colitis is an inflammation of the colon, and there are a lot of different things that can cause colitis, from diseases to inappropriate food items, etc. So we do keep an eye on that. Oftentimes what you'll see is the animal will be laying down, maybe rolling, maybe looking back at their abdomen, in pain, just maybe biting at their flank, etc. So it's a really large, very important organ for digestion, and it does take hospitalization often in order to treat colitis. Oftentimes we have to have them off food for some time, and so we want to make sure that we're supplementing them with fluids and alternate nutrition. Choke. Choke is different from what you might think choke is. In horses and cattle, choke is actually a blockage of the esophagus, not the trachea. So it's not an emergency where we would think we're choking, we have to breathe within 3 minutes, we have to get that out. It's an emergency in that they can't eat, they can't digest. It may take a couple of days, but with choke, they can die. So we have to be really, really careful with that. And it can do some pretty good damage to the esophagus, because if something blocks the esophagus for long enough, it will kill the tissue. When you have dead tissue, you have openings to the environment, and you're going to get infections. So what we're going to see is that a partially digested food just pouring out of the nose. And it generally comes out the nose, not out the mouth. So what happens is they eat a large item like an apple or a hedge apple or something like that hasn't been broken down into pieces, and they just swallow it, and it stops and it gets stuck in their esophagus. And if you've ever taken a large pill that's gotten stuck in your esophagus, or it feels like it's going down sideways as it goes down, it can be pretty painful. So a lot of times they'll be coughing and hacking and trying to bring that up. Obviously the coughing doesn't really work because you're moving air through the trachea, not through the esophagus. But that's your goal, is to try to bring something up, and that's what your body wants to do. So we need to push that back down into the stomach typically. So we take a lubricated tube through the nose, all the way down into the stomach, try to flush it out and try to get it out. So again, it can be really dangerous, esophageal choke. Potomac horse fever. Potomac horse fever is a disease that is passed along by snails. Snails carry this Ehrlichia rustici, which is an organism. It's a Ehrlichia or a rickettsial organism that lives within the body of the snail. And what happens is the animal will graze around marshy areas or around water and inadvertently pick up the snail and eat the snail, and then the organism is released into their digestive tract and then into their bloodstream. There is a vaccine against Potomac horse fever. It is a disease that has been seen in this area, so we are careful about that. The vaccine is not 100% effective, so they can still get it if they are exposed to this organism. The reason I have this X-ray here of the foot is that any type of fever Any type of illness can lead to laminitis, but this is one of the side effects of this Potomac horse fever is we get a laminitis, a founder as well. Neurologic disease affecting the brain and the brainstem. Rabies is a disease that we see in large animals, and it's because we don't expect to see it. And when we don't expect to see it, we tend to expose ourselves to it. Now, they don't necessarily get raging mad. Sometimes they just get really wobbly and dopey and kind of sleepy. But it is something that's in our area, they are exposed to, and we highly recommend a rabies vaccine. Not everybody considers it a core vaccine. I do. I do vaccinate my horses against rabies. I have raccoons in my barn and around the area. I have feral cats. I have coyotes. I have foxes. So I want to make sure that my guys are. Another core vaccine that we use and because of this disease is a viral equine encephalitis. It's actually really common, and it causes a softening of the brain and a swelling of the brain. So neurologic diseases are what we'll see. There are a lot of different types of viruses. Is Eastern, Western, Venezuelan. There's also West Nile virus, and they are all in this area as well. Can cause swelling as well, so highly recommend that you put on bug spray. Mosquitoes are the ones that carry this disease. So mosquitoes are nasty and they carry lots of diseases. So viral equine encephalitis, Eastern, Western, Venezuelan, West Nile. Those are common core vaccines that we can vaccinate against yearly. All right, some other things. Moldy corn disease. So if you're feeding moldy feedstuffs to your animals, this can happen. It can come on fresh corn, it can come on dry corn. The disease it causes is leukoencephalomalacia, which, if you break it down, is white brain softening. So if you look at the brain, a cross section of the brain, you can see this white matter here, which is not normal. And if you touched it, you could see that it's kind of softer than normal. So leukoencephalomalacia, caused by moldy corn, causes a softening and whiteness of just abnormal brain. And that typically, it can be treated to a certain extent, but often leads to euthanasia as well. Head trauma. Now, horses are not always the smartest creatures. They tend to be flighty. That's their job. They're prey animals. So if they are not conditioned to surprises, if they're not desensitized to certain things, they will startle. And if they're in areas where they can rear up, they'll fracture their skull. They will either fracture it on the top, here on the forehead, or on the poll here. And if they hit it hard enough, they can actually kill themselves. So head trauma is something that we do see. Wobbler syndrome is a spinal cord disorder that is genetic. And what happens is that these vertebrae do not form correctly. And so as the horse grows and moves, it will start to pinch the spinal cord. And this is just an example of doing a neurologic exam in a horse where you're walking them around, turning them in tight circles, seeing how they place their feet. This is somebody one person walking, another person trying to pull them off their stride by tugging on their tail. If you can do that fairly easily, then neurologically they're not sound. There's a surgery that we can do to stabilize this, but these horses will never be super normal. Another disease of the spinal cord, equine protozoal myelitis. As the name says, it is passed along by protozoa, so one-celled organisms that lodge themselves in the spinal cord and in the brain. So these guys will become paralyzed, unable to walk. It is a treatable condition, but it takes months, if not years, to treat with an anti-protozoal medication, sometimes physical therapy, etc. We have this horse here in a sling because it's really dangerous for any large animal to be down for any length of time because the blood flow is really important to their limbs, otherwise they won't regain it. These are examples of the animals that can carry the protozoa. The most common critter to be found with it is the possum. So we blame the possum a lot for this, equine protozoal myelitis. Herpes does it again, respiratory, abortion, and the neurologic system. So they can be have herpes and have to be put on antiviral and supportive care. Herpes does live in the system forever, so you can put it into remission, but we always have to watch for outbreaks. Again, this is an animal that's being supported so that he's on his limbs. Equine degenerative myelopathy, there's a lot of different possible causes for this. One could be a low vitamin E, low selenium in the diet. But again, it's a progressive disease over time, will cause degeneration of the spinal cord. So again, here's somebody doing a neurologic exam on a horse. Again, horses are not always the calmest animals, so having a vertebral fracture, they swing their head against a stall or a post or something like that, and they could get a fracture of the neck, and that can be fixed surgically. Tetanus, this is a core vaccine. The Clostridium tetani is a bacteria that lives in this environment. It is everywhere. It's in feces, it's in dirty things. And so if they are not properly protected, any wounds like umbilical openings could be an opening to the bloodstream, and the tetanus bacteria produces a toxin that causes rigidity of the muscles. This is a typical sawhorse stance in a foal that needs to be treated with muscle relaxants and some medication. So we give them an antitoxin which kills the toxin. We have to be very careful with when we vaccinate them, that we don't give an antitoxin at the same time, because that one will overwhelm the other, and like the antitoxin will kill the toxoid, so that's not helpful. The toxoid will last for anywhere from 6 months to a year, so we do vaccinate with that at least yearly. Botulism is another clostridial bacteria that causes paralysis, and it generally starts with a paralysis of the head and neck and the tongue, so they stop eating and will lead to paralysis throughout the body. So they become neurologic and progressively so, and will over time either need to be highly supported or they will die. And I did have a friend whose horse had botulism a couple of years ago, got it from eating, basically she saw her do it, one bite of a big hay bale, a round hay bale that the horses were eating from. One bite contained some pretty nasty hay that looked like an animal had died in there, and that's not uncommon. My mom got the horse away after that one bite, but within a few days, the animal's tongue was hanging out. She was drooling and unable to eat. She had to go up to Ohio State for 3 days, and over $3,000 later, they had to bring her home because of cost, and they had to tube feed her for months. So she wasn't able to eat on her own for a number of months. So botulism is another vaccine we can actually give. I do give to my horses just in case. I don't want to go through that. Ringworm, dermatologic diseases. Ringworm is a fungal disease, and so you can have fungus in the environment or from other animals, and it will cause these round lesions with some hair loss and also some skin, like flaky skin around it. This can be cleaned up with chlorhexidine solution or iodine solution. We can put them on an antifungal medication. Basically need to keep the environment clean and keep these guys clean, and wear gloves when you're treating it. This is a disease called, there are two different diseases. They're caused by bacteria or fungi, rain scald and rain rot, and it happens in moist conditions when the animal just doesn't have a chance for its coat to dry out. And so the moisture damages the skin, so the bacteria and the fungus can enter the skin and cause these patches of hair loss. So it kind of looks like paintbrush alopecia is what we call it, like somebody took a paintbrush to these guys and just wiped off the hair. Culicoides hypersensitivity. Culicoides are flies, biting flies. And if an animal is allergic, can you imagine being allergic to flies when you're a horse? They will get swelling all over their body. They'll get very, very itchy. It can be just maddening for these guys. So having them on a fly preventive, trying to keep flies down as much as possible is important. Sarcoids. Sarcoids are these hyperplasia. They're benign growths on the skin. They can look like a number of different things. So they can look like these plaque type growths. They can look like this, or they can progress to this. And so we want to get them off when they're small. Melanomas are common in white or gray horses, and we typically see them on the pigmented skin under the tail. Again, the sooner we get them off, the better. Eye diseases. One of the common ones that we see is a recurrent uveitis. It's also known as moon blindness. This is just a lot of protein and inflammatory cells that you can see in the eyeball itself. And it's just an inflammation of the structures of the eye. They can also get ulcers, get stuck in their eye, or scratches from hay. If they get a scratch in the eye it gets infected, it can turn into a melting corneal ulcer. And if that melts all the way through all the layers, all these little tiny layers into the eyeball will rupture and you'll lose the eye. Very difficult to get these guys to open their eyes. They've got really, really strong eye muscles, so putting medication in the eye can be really hard to do unless you have a really relaxed and calm horse. So a lot of times what we'll do is a little surgery, put a stab incision in the eye, just above the eye in the eyelid, run a tube down their neck, so that we can put medication just by standing at their side, put medication in their eyes. Musculoskeletal. Exertional rhabdomyolysis, or myositis, I think it should say myositis, not myositis. It's also known as tying up. And what happens is that if they race really hard, or they have a lot of they exert themselves a lot through endurance, or a long race, or just really working hard, and they're not cooled down. Their muscles aren't relaxed by walking them for a period of time and then giving them a little bit of water and then walking them again and a little bit of water. Their muscles won't be able to release the lactic acid, and it will build up in the muscles. It will actually start to damage the muscles and eat away at the muscles. So it'll cause a blood-stained urine because of the muscle, the myoglobin that has been broken down goes through the kidneys, and you see this blood-stained urine. Their muscles will be completely contracted. They won't be able to relax their muscles at all. It's very, very painful. So that's what's called tying up, exertional rhabdomyolysis. Laminitis or founder, one of the most common diseases that we see. This is a typical stance of a horse that is foundering. They stand on their back legs because it typically affects their front legs first. Eventually, if it affects all four limbs, they won't be able to stand at all. It's just imagine if your feet were swollen and you had to wear shoes all the time, and your feet were so swollen in those shoes, you wouldn't be able to walk really well. And that's exactly what is happening. We have these hard hooves here, and the interior structures of those feet, the bones and the tissue around the bones are so swollen that they're just feel like they want to burst out of those hooves. The hooves will look abnormal as well. They'll start to grow abnormally just because the way they're not walking. You will start to see some changes in the bone. So this is the start of inflammation of the bone. We have bone spicules growing off of the bone in odd ways. Eventually this will get so swollen that the bone will start to rotate, and it will rotate downward as they put pressure down. The bone will actually eventually come out of the bottom sole, and that's a euthanasia. We can't fix that. So laminated legs is caused by a number of different things. Anything that causes inflammation, fever, any increase in the immune system, colic, whatever, anything that causes inflammation in the body of the horse will lead to laminitis or founder. Overeating grain or really high sugary grass will lead to founder. Being overweight can lead to founder. So a lot of different things lead to founder, and we have to watch for that very, very closely. I have one horse on my farm. I have 7 equine on farm, 2 are donkeys. One horse is a boarder, and the horse is very prone to founder. So he can only go out and graze on grass for an hour a day, which is an improvement. He used to not be able to do it at all. But if he goes out for more than an hour a day, he will start to be painful on his front limbs. And so I have to watch him very, very closely. Treatment for founder. Obviously, anti-inflammatories, increasing the blood flow to those limbs. So there are a lot of medications that will do that. Um, uh, Watching their diet, helping them to lose weight, not putting them on a restricted diet. Hay only is a good idea. There are certain supplements that can also help reduce founder as well. All right, so I want you to kind of absorb everything we talked about equine. I'm going to stop the video here so you can kind of go back and review, write down any questions that you have so we can talk about that in class.